Significantly, the levels of incomes of the households were severely affected by COVID-19. If you compare the income levels before COVID and then after COVID, there was a very, very significant decline. And what that meant is that people now started looking for other options of replenishing their incomes. How could they make their families survive? And in situations where you had, we noted that some families, some households that had household heads as men disappeared because they couldn't afford to sustain their households. So the biggest part of the work now was left for women to ensure that they continue surviving as households, continue to fend for their households. Now what that meant is that they started looking for all possibilities of survival, including engaging in multiple sexual relationships to try and see who can bring them some little money. Others started indulging in transactional sex, selling themselves.
We had an increase of teenage pregnancies and an increase in HIV, new cases of HIV. And I don't know, maybe for the subsequent studies or interventions, we should be able to target this population such that because some of these effects are still continuing.
In those ways, we look at the economic, social development. I'm seeing PDM at this is on board, even as we are doing PDM down there. When they come, we are telling them of saving and all that. And different demonstrations, we are doing even facilities, we are doing demonstration gardens of how they should plant foods within sacks, segregating in an area of a rental.